All right, fantastic. The conversation this morning was really tremendously helpful and illuminating. And so what I'm saying today will in some way touch on some of the things that were raised in the discussion before. So my field is political philosophy outside the domain of public health and ordeals. But I've written on the value of time, and I've argued that people have claims of justice to free time. So my points this morning are going to focus on the time dimension of targeting through ordeals. All right, so time cost ordeals might sometimes be an efficient way of targeting the allocation of a scarce resource. So as in Dupas' water chlorination study, the ordeal can sometimes reduce errors of inclusion, so providing the good to the people who don't actually need it, without increasing errors of exclusion, that is, without having any increase in lack of access to the good for the people who really need it. But even if a time-cost ordeal is efficient and in this way and does not increase errors of exclusion, it does still impose costs, even for the people who do manage to go through the ordeal. And these costs might potentially constitute unfair burdens on the recipients. And so I'm not going to be making an all things considered argument against using time cost ordeals. I agree with what was said earlier that the evaluation of an ordeal depends on all of the various factors and the particular context. But my point is instead that when we're making this all thing considered assessment of whether or not a particular ordeal is justified, we of course have to consider more than just its target efficiency. We have to consider a full range of effects, and some of those effects are the kinds of burdens that the ordeal itself imposes on the recipients who undergo it. All right. So there are two primary ways that time costs may be used as a means of targeting. So the first is the total time that the ordeal requires one to spend to obtain the good. So there's all of the time that you have to spend waiting on hold, filling out the long and complex forms, traveling to the office to submit the form or to get to the doctor's office, then all of the time you spend waiting at the doctor's office, and so forth. But in addition to this total amount of time you have to spend as part of the ordeal, there's also the ways in which the ordeal can constrain your time. So you might have to do certain ordeals at certain times. So you can only call the office during certain hours, or you can only submit the form at certain times, and so forth. You might also have these constraints imposed on you at certain intervals. So if you've recently been through insurance, myriad of maze that it is, you can imagine situations in which you have to submit a form, then wait 3 days for it to be processed, then call back after 3 days, but not longer than after 10 days, and so forth. You can imagine this kind of intervaling happening through the ordeal. And then on top of that, the ordeals might require you to coordinate with other people. So this also puts a constraint on your time. So in order to make it to the office at a certain time, in order to fill in the form at the benefits office, you might have to coordinate with your employer so that you can get time off of work and so forth. Or if you have children, you might have to coordinate with someone else so that they can provide care for them while you engage in the very lengthy paperwork and so forth. So beyond the basic total time that the ordeal imposes, there are all these other ways in which it can constrain your time. So how much a time cost ordeal reduces and constrains people's free time, of course, depends on how much time it requires and how much it, in fact, constrains your time, and, of course, also on how often you must face the ordeal. So if you or one of your family members has a serious or chronic illness, you might face much more onerous time cost ordeals than someone who only goes to the doctor for their physical exam. And importantly, how burdensome the ordeal is will also depend on whether one faces such time-costly ordeals in a variety of other domains as well. And so this point came up yesterday at some point, that you have to consider not just the ordeals that the person faces with respect to healthcare, but the ordeals that the person faces in all other domains. So if a poor recipient has to go through an ordeal every time they obtain any kind of social service benefit, you can imagine that they would end up facing a significant time tax, every time they go to the office to get a transportation pass or a food stamp or a rent subsidy and so forth. So all of these costs can add up. All right, so when we're making this all things considered assessment of an ordeal, the fact that time costs can reduce and constrain people's free time ought to be taken into account, I think, for several different reasons. So the first and most fundamental reason is that free time itself is a valuable resource, and people are entitled, as a matter of justice, to fair shares of free time. So what constitutes a fair share can be specified in different ways depending on the particulars of different principles of a theory of justice, but just for simplicity's sake here, we can say that people are entitled to a sufficient share of free time. So the argument for this claim that people are entitled to a sufficient amount of free time, which I make in a book fittingly called Free Time, rests on this widely held commitment that people are entitled to the means that they require in order to exercise or make effective use of their liberties and opportunities. So the principle is rooted in this widespread recognition that if you possess a set of liberties, but you don't possess the means to make effective use of them, you possess them in name only, or you don't really meaningfully possess them, or they're of little worth, this kind of commitment. And so this commitment is most often applied to people's needs for material resources. And so this is part of why we think people have an entitlement to a fair share of income and wealth so that they can make effective use of their liberties. But the same point applies to the resource of free time. So time also is a resource that we require in order to exercise our liberties. And specifically, we should think about free time as the time that is not consumed by meeting the necessities of life, that one can devote to one's own pursuits and commitments. So everyone must spend some amount of time meeting these necessities of life, whether with household work, caregiving labor, paid work, or personal care. And our free time is the time that is not devoted to meeting these basic needs. So the way in which we require free time to exercise our liberties is readily apparent on reflection. So to take a simple example, think about the freedom to exercise one's right to vote. So in order to vote, you have to have, of course, the means to go to the polls, but on top of that, you also have the time that you require and actually to go. And so this point generalizes. So any of the things that we're legally free to do, any of our liberties and opportunities generally require both material resources and also the resource of free time. And so for that reason, people have a claim, I argue, to a sufficient or a fair share of free time, again, depending on your full theory of justice. So the important point when we think about ordeals is that when we use time costs to target the allocation of basic goods, what we're effectively doing is making it more time costly for people to meet their basic needs. So we're increasing how much time it takes people to spend meeting the necessities of life. And in that way, we are reducing and constraining the amount of free time they have available to devote to any other ends they might wish to pursue. So when time costs do this, when they reduce and constrain our free time, it's possible, depending on how onerous they are and the conditions that people face, that they might push one below having their fair share of free time. It might cause a deficiency of free time for the recipient, even if they do manage to undertake the ordeal and are not denied access to the healthcare resource. There's this other cost that they are bearing. Or it might be more often the case that people who are already time poor, their deficiency of free time is worsened, and so the injustice that they already face is now deepened by the time cost. All right, so that's the most important point to make. But in addition, reducing and constraining how much free time people has also can undermine their ability to participate in the social lives of their communities. So in order to engage in most ways of associating with other people, we generally have to spend time together. But if the ordeal reduces and constrains our free time, it might thereby limit our ability to find time that we share with other people. So if you have to pay very onerous time costs, I mean, imagine all of this time filling out the paperwork, waiting on hold, trying to get all of the coverage and so forth. And if you have to do these things at particular times, say when the office is open and so forth, you might be then less able to participate in gatherings with friends and family, to engage in recreation or religious practices or other community and political associations and so forth. Now, and then an additional cost that follows from the previous two is that if your social status is undermined, if you're unable to engage in a set of shared or common experiences in your society, then it's also possible that apart from whatever stigma the ordeal itself imposes, it might be the case that the loss of time also has this kind of undermining effect on social status because you thereby lack this means to participate in things that everyone else in your society is participating in. And then the last point to make about these additional costs that we ought to consider is that for the people who already have very little free time, increasing and constraining the amount of time that they must spend to meet their basic needs might have a negative effect on their ability to meet their other needs and obligations. So someone might decide, that their health insurance really is so important that they're going to devote all of the time that's required in order to get it and to get the coverage, but it's so time-consuming and their time is already so scarce that they might then be less able to meet their other obligations, say their caregiving obligations or their obligations at work. And given that low-income people are more often to have inflexible work schedules and have to work mandatory overtime and so forth and have more precarious labor employment, it might be the case that they are more vulnerable to this exposure of basically losing their job or being penalized at work because they're undertaking all of these ordeals. All right, so again, though, this isn't to say that, even if an ordeal does all of these effects, it's therefore impermissible. I think we have to engage in an all things considered assessment that includes an assessment of how scarce is the good, what are the other alternatives, and what are all of the other costs and so forth. But the last point I just want to make, kind of echoing some things that were said in the previous talks, is that I think that we should also be considering what are the alternative mechanisms, of course, for rationing. And I think that there are some reasons that we might want to reflect on why we might prefer progressive monetary costs as a means of rationing rather than time costs. So the first, which has already been mentioned, is that given existing data, we have a lot more information about how much income and other assets people have, and we have relatively little information at this point about how much free time people have, especially when you think that time is not just work hours, it's how much time you have to spend on caregiving, on personal care, on all of the other household labor. I think that ultimately we ought to be collecting this kind of data so that we can ensure that people do have their fair share of free time. But in our existing world, we don't have that kind of data. But instead, we do have a fair amount of information about how poor people are. And we already go through means testing with the provision of healthcare. And so the information is much easier. The second is that given that we do have this information, and then given additional features, it might be much easier to implement a highly progressive monetary cost rather than a highly progressive time cost. So Chris mentioned this, I don't know where he is now, before, but imagine the difficulties involved in trying to make a highly progressive time cost ordeal. So first you have to have information about just how time poor people are so that you can make it appropriately progressive, which is information at the moment we don't actually have. And then on top of that information, you'd have to have some reliable mechanism so that the people who are time poor could, say, be sorted into one line where they have to fill out a short form or they only wait in line for 5 minutes, and the people who aren't time poor are put into another line where they have to wait for an hour and fill out really long forms. And so you can kind of imagine the difficulties. Not to say it's impossible, but it seems like it's going to be much more difficult to do a highly progressive time targeting. And then the last point is that it's also easier to make a monetary cost refundable. So refunds might be an effective targeting mechanism. So you might be, it might be an indicator of your willingness to, or your need or your willingness to use a good if you are willing to pay for it up front and then wait for the time for it to come back to you in a refund. Right? And of course, you wouldn't want the refund to be so onerous that the person couldn't pay the upfront cost. That's an important point to make. But so the monetary cost refund might be an effective ordeal, but it's much more difficult to make a time cost refundable. So once you've spent those hours at the doctor's office or waiting in line, those hours are gone, right? So the only way that they could be repaid back to you is in the form of money. But for a variety of reasons, our money is not perfectly fungible with our time. So again, to think back about employment, most terms of employment require you to work a certain number of hours, so that if you, say, got a refund from your doctor's office for this extra money that you're now going to use to buy time, you'd have to go to your employer and say, can I buy myself out of 2 hours because I've got this voucher from my doctor's office? And they're going to say no, of course. And so it's difficult. You'd have to find some other way in which you could buy yourself out of that time. And so for all of those reasons, I think we might have a default in favor of using a highly progressive monetary cost, at least in the existing world, with little information about how much free time people have, rather than an ordeal. And I think that we might also have reason to use that as a default, given that as we've been talking about, whether or not a particular ordeal is justifiable depends on all of these complex, all things considered judgments that take account of a lot of different empirical factors and all of their various effects. And it might be easier to have as a default that we rely instead on progressive monetary costs with easier to anticipate effects. Thanks.
Okay, good morning. Can everybody hear me? Great, thanks very much. It's great to be here. I'm not an expert on ordeals, academically. My life is one big ordeal. So in that sense, I speak from more personal experience. But what I wanted to do this morning is to try to identify, at least for myself, thinking about what is distinctively troubling or problematic about this idea of rationing by ordeal, right? Trying to identify that. And in the course of trying to identify that, I actually want to raise the suggestion that, in fact, we may want to reevaluate the use of the market in many cases precisely for the same reasons. We may be critical of thinking about the use of ordeals in rationing. Okay. So what do I mean by this? So when we think about the market for allocating scarce goods, right? I take it that the major concern that we have in thinking about healthcare is that relative to some idea of what constitutes an efficient allocation of resources, whether it's need, whether it's maximizing social utility, that the market mechanism is not going to allocate it relative to this metric that we have for how we would like to see those allocated. I take it that's sort of the general criticism of the market, because a price mechanism may not be working in certain cases, or maybe that, for example, we have an egalitarian notion of how the good ought to be allocated, but the market itself doesn't respect egalitarian considerations if there's unequal distribution of resources. So I take it that's sort of roughly how we might think about the general concerns about using the market as a way to allocate scarce resources in the context of health. So I started thinking to myself, I said, well, so what is different then about the case of ordeals? Right? If we think of ordeals simply as non-pecuniary costs, non-pecuniary burdens, in a sense, maybe it's not that different from the kinds of concerns we have about markets. And in some cases, as we've been talking about before, in terms of information revelation mechanisms, it may be superior to markets with regard to how we think about the allocation of scarce resources relative to whatever metric of efficiency or allocation we have in mind. So then the question was, well, then why are we so troubled in thinking about ordeals as a way to ration or allocate scarce resources? And what I take it that is troubling is, at least as I understand it, and here I speak from my personal experience, is that an ordeal is a deliberate introduction, right, of a very specific kind of cost or burden, right, for the agent to have to incur in order to receive the good or service in question. And that specific kind of burden is to have to engage in a series of actions that are prescribed in order to achieve that access to that burden, that good or service, right? So in other words, you have to fill out this form, right? You have to stand in line. You have to walk across a certain distance to go to the doctor. You have to fill out a voucher to receive. So it's these aspects, I take it, of that introduce the idea of that's a non-pecuniary aspect of the ordeal. And that kind of a burden isn't just simply a burden, although it does have burdens with regard to, say, time cost. It does have burdens, say, with regard to opportunity cost, things like that. I take it that the burden is more than that, really. It really actually is at risk of undermining two principles that I think are important to keep in mind. The first is a dignity principle, right? And the second one is a principle of respect for autonomy, right? So in terms of dignity, right, if it's a case that people have to line up and stand in lines, that may seem to, by dignity here I mean something like what Waldron has in mind, which is something like high status, right? So high status, that we're all sort of high status, like aristocrats, and so then having to stand in line or wait in the doctor's office for 2 hours could be seen as undermining dignity. And this isn't a question just simply of distribution, right? So I take it, I liked your point, Professor Hausman, about the idea about how, well, in the case of the wealthy person and the poor person both have to sit in the doctor's office for 2 hours. That's a kind of an egalitarian distribution. But from the perspective of dignity, right, we might argue that that's actually equally undignified, as it were, for both of those people, independently of the egalitarian aspect. So by dignity, I have something in mind differently simply from an egalitarian distribution, but really this idea of a diminishment of a status of an individual or person, right, in virtue of the actions that he or she is asked to perform in order to achieve access to some important or valuable service or good. On the autonomy piece, right, I think asking people to engage in certain activities, right, in order to achieve some some benefit or service, there are risks that can be coercive, right? Depending on how great the need is, right, and depending upon the kinds of activities we're asking people to go through. So I'm not saying that all ordeals are coercive, but there is this sense in which that is especially coercive in that kind of sense. And so there I want to suggest then, if our concerns, though, are about the coercive nature of ordeals and about the potentially dignity limiting or reducing feature of ordeals, then we may also want to rethink many instances of the use of the market also in allocating scarce resources for precisely some of the reasons that came up earlier in the discussions, right? So, for example, it may be the case, right, that allowing some people to pay out and not others not being able to pay out is a violation of sort of thinking about status, dignity, right? And similarly, in terms of coercion, it may be the case that if the person is in dire need and has to engage in all sorts of activities to be able to meet the price to gain access to the benefit or the service, that's equally coercive as well. So if that's the case, then ordeals and the market are maybe not so different, right, in terms of how we think about our concerns about them in terms of allocating scarce resources, but not from the perspective of whether or not they achieve them from a perspective of a fair distribution or an equal distribution, but really from the perspective of thinking about these other values of coercion and autonomy. And I want to suggest and throw that out there, right, that maybe coercion and then in terms of autonomy, also thinking in terms of dignity and status, those are where the real action are in sort of thinking about the question of allocating scarce resources in the context of healthcare. So thanks very much, and I look forward to engaging in a conversation with all of you.
Good morning, all. So, as many people during this workshop has pointed out, as well as Julian Nien-hê just before me, of course, there are many different reasons to be concerned about the use of ordeals because they actualize some kind of cost in non-monetary dimensions. So on Julie's view, we have reason to worry about time-consuming ordeals, not only because they might be exclusionary, although they might be, but also because free time is valuable. Is a valuable non-monetary resource that people have valid claims on. And as Nien-hê pointed out, we might also have good reasons to value or to care about how ordeals might violate dignity or autonomy. And there might, of course, be many other different reasons, such as fairness. Yet rather than adding to the list of reasons to be skeptical of ordeals, I would like to take the opportunity to discuss the issue of how we might care about non-monetary value dimensions and how we might think about how the cost dimensions relate to the benefit dimension. And I take the point that many people have also raised before me that this has to be context dependent because we speak about ordeals in so many different contexts. But I hope that these remarks will be more or less generally valid. But that also means that I'm going to remain at a quite abstract level. So in other words, how might we think about and evaluate the permissibility of ordeals, the use of which generates some benefit, but also imposes some non-monetary cost on recipients of the good? So for instance, how might we think about and evaluate the permissibility of an ordeal that improves the overall health outcome, but imposes a cost in terms of time on recipients of the good? So to simplify the presentation, I'm going to call the value dimension in which the benefit of ordeals is measured the benefit dimension, and I'm going to call the other dimension the cost dimension. So both of these dimensions will differ depending on our context and also depending on the kind of ordeals we're talking about. But characteristic for the cost dimension, at least such as ordeals has been defined in this workshop, is that it's a non-monetary dimension. Also the benefit dimension might be non-monetary, but I think it could also be a monetary dimension. So how do these two dimensions relate to each other? There are three different possibilities that stand out, I think. So the first possibility is that we can think of this in terms of some covering function that allow for standard cost-benefit thinking, so that there is a continuous function that helps us identify some kind of cutoff point at which the benefits outweigh the costs, so that the ordeal is permissible. So for instance, a very simple illustration, it might be that we think that for each equivalent of a life year at perfect health, it's permissible to impose a time cost of 3,000 minutes on a population of 100 people, something like that. And this doesn't have to be linear, of course. It can take different shapes, this function. So another possibility is that there is what has been called strong superiority in value between these two different dimensions, or between two dimensions. So that either the cost or the benefit dimension is so much more important than the other, so that no amount of value in one dimension can outweigh any amount of value in the other dimension. So for instance, we might have the idea that no gain in life years or life year equivalents can outweigh any time cost for any individual. And then the third possibility is that there is some kind of covering function that we can use to weigh the benefits and the cost against each other, but there are discontinuities in this covering function, so that there are certain amounts of costs or benefits that make the costs or the benefits significantly different, and that this has vast implications for how benefits and costs should be weighed against each other. So for instance, for each life year gained, it's worth imposing a time cost of 30 minutes on each of 100 recipients, unless people have less than 2 hours of free time per day, in which case the trade-off changes radically, so that at that point it might only be permissible to impose a time cost of 5 minutes in order to gain the same benefit. So whereas I think that what I would call here standard cost-benefit analysis might lie close at hand for a lot of people, I believe there's something to be said for the relevance of both of the other positions when we think about ordeals. So first, strong superiority in value, which might seem to be a very implausible view in the context discussed in this workshop. So for example, if we can improve the health outcome by some significant amount, and we can do that at some very, very small cost in terms of time, that seems to be permissible. However, I think that I suspect that this idea of strong superiority in value might lie in the background when we consider what kinds of ordeals we should at all be talking about. So, for example, there's a reason we do not discuss introducing an ordeal that involves eating pork in order to weed out members in a Muslim majority society from getting some health benefit, even if that might improve the health outcome. And one explanation for why we don't talk about that kind of ordeal is that we simply think that the kind of religious integrity that would violate is strongly superior in value to the health benefits that we might generate. Discontinuity in value is, however, more directly relevant, I think. So on my understanding of Julie's suggestion, when she distinguishes time costs from time costs that infringes on someone's fair share of time or sufficient amount of time, what she does is to introduce some kind of discontinuity in the time dimension. So something happens in the time dimension when one crosses into people's fair share of time, according to Julie. But embracing these kind of discontinuities has implications, which I think we might want to think about. So first of all, of course, we have to determine where these kind of discontinuities arise in order for us to be able to use them. And a more theoretical problem is that once we accept these kind of discontinuities, we seem to have to accept that wherever we place them, a time cost that is only ever so slightly smaller is significantly less problematic, so that we can impose it on significantly more people and without doing anything that's worse. And how do we defend that position? So thinking of the relation between cost and benefit dimensions allows us to start asking more acute questions, I hope. What, if any, dimensions might be strongly superior in value to what dimensions? Are these continuities, like the ones Julie seemed to embrace, at all plausible, and where should we locate them? And another issue that I want to mention, at least, or say something about, which is related to this, is the relation between different kinds of ordeals or different methods of delivery. So Julie mentioned at the end of her talk, and Richard stressed this yesterday, that when we talk about ordeals and whether or not an ordeal might be permissible, the most pressing issue is how ordeals as a method of delivery relate to alternative methods of delivery. And so maybe most pressing, how does ordeals relate to, how does the method of delivery that involves ordeals relate to methods that involves financial costs or monetary costs? So are monetary costs less bad than non-monetary costs? And it might seem that we can think about this in terms of a simple comparison between a monetary cost dimension and a non-monetary cost dimension. And then, for example, we might ask the question whether the time cost dimension there might be some discontinuity that means that sort of outweighs the monetary cost dimension. However, one point that I think is important to bear in mind when we think about how different methods of deliveries relate to each other is that we can't assume that the benefits will be exactly the same, regardless of which method of delivery we choose. So when we make the choice between allocating via some monetary cost or via ordeals, it might be the case that the choice of method of delivery has implications for both the amount of benefits we get and the distribution of these benefits. And if that's the case, when we make a choice between methods of delivery, we cannot avoid also making a comparison between the cost dimension and the benefit dimension. And again, I think that to answer that question, we might benefit from thinking in terms of whether or not there's some kind of continuous function that we can make trade-offs with, or whether there's some kind of superiority in value or discontinuities, or what may have. So that's my remark. Thank you.
Great. Well, I will start us off with a few questions for 10-15 minutes and then open up to questions from the audience. So all three of you stressed in your remarks the importance of thinking about the types of burdens that ordeals impose. And starting with Julie, stressing the cost to, if among the principal burdens that ordeals impose is a cost in the person's time, and sometimes we're speaking about inconvenience, but often what we're referring to is really just sitting around and having to, or wait at intervals and so on, then I take it all three of you agree that it'll be important to evaluate particular kinds of ordeals by thinking about the types of burdens imposed, the priority of avoiding those burdens, and the relative significance. So Julie stresses free time is its own kind of good that we should worry about the distribution of. How significant the imposition of an ordeal that takes up a person's time is, I take it, will depend not only on how much free time that person has, how low they are with respect to that good, but also, as Andrews has stressed, the relative significance of free time relative to the other things that we're trying to distribute and that we're taking away from the person through any alternative mechanism of rationing, say cost rationing. So I guess the first question is just, do you have more to say about how we should think about the relative significance of these two dimensions of cost, or these multiple dimensions of cost, and the priority of avoiding them? Because it looks like free time came up in one dimension. It's a good to be distributed fairly, and so we should pay attention to the distribution of free time and the ways in which imposing time-costly ordeals on people takes away from different participants' free time differentially. But it seems to me it'll also be tied up with various rights to freedoms that people have, because when you're subjected to a time ordeal, you're subjected to sitting around, you're subjected to a person's instructions, you're not free to leave, at least you're not free on pain of foregoing a very important resource to which you have a need. So is that connected with liberal considerations, rights considerations? How do you have more to say about that? I'll just open it up.
All right, fantastic. Yeah, that's a great question. And when preparing these remarks, so Nir and Anders had asked me to speak about the time dimension, and then, but as I was putting it together, of course, the most important point to make as a preliminary is that it's just one factor in an all things considered assessment, which of course led me to do some reflection about how we ought to do that all things considered reflection. And I don't pretend to have an answer to that question. But I did have some thoughts about it, that didn't come out in the presentation that I've been reflecting on. And I think Professor Hausman's, remarks were also helpful in thinking about this earlier this morning. So one thought is that we should start with some idea of what kinds of claims people have across a full range of domains, and also how scarce resources are. But that we shouldn't, when we're focusing on a particular good in question, I don't think that we shouldn't, just as a kind of preliminary point, we shouldn't start by assuming that a particular good has a particular degree of scarcity. Because, of course, how we arrange our social institutions is going to affect how scarce that good is. So this is something that Lucas has worked on. So healthcare is a good example of this, where healthcare might be scarce in some regions of the country, but that's only because doctors don't go work in those regions of the country. And that's something that is potentially open to our influence. So we shouldn't start with an assumption of scarcity that isn't itself something that we put into the full range of considerations. So that's one point. We'd have to start there with your work on what's produced. Then that has to be taken into account at the same time as we're thinking about what kinds of things people have a claim to. And so that's going to be a claim to certain kind of means to exercise certain liberties, but also the liberties themselves, and then, of course, how they are connected. And the liberties will both have an effect on both what we can induce people to do and on what they are entitled to. So that's very abstract, right? So that's just some kind of, to say that, it's a big abstract question. To be a bit more concrete about the question of how we should think about the good of free time in its relationship to people's liberties, and the fact that, say, if you really need a certain healthcare treatment, and the only way to do it is to sit in the doctor's office and to wait for 2 hours to obtain it, you're not only losing out on your time, you're also having your liberties constrained. This is the point you're making. There's a way in which you're sort of imprisoned in the doctor's office while you're sitting there waiting for those 2 hours, if you really do need the medical treatment. And I think there are different ways to think about how these things are connected, but one thought is that we shouldn't only be concerned with how much free time people have, but whether or not they possess it under conditions that allow them to make effective use of it. And so some of those conditions are going to be internal to the time itself. So they have to be things like you have to have free time under periods of sufficient duration. So if you're constantly being interrupted, say you are, I'm trying to think of this in an ordeal example, but if you are always on call for your doctor to be potentially available to see you or something, that's going to constrain the conditions under which you can use your time. But that'll extend more generally to all of the different conditions that obtain when you're trying to make effective use of your time.
I think, if I understood the question correctly, at least, I think that my view of this is, or I'm going to sort of interpret Julie now as well. So I think that the way time and the liberties relate to each other, and also relates to what I tried to say in my presentation, is that so it's when the liberties sort of have a certain relation to the time that we take into account. So when the time starts infringing on these people's liberties, and these very significant liberties maybe, that's when you can start thinking or making a good argument for how there's some kind of discontinuity in how we should value the time or cost for these individuals. So I think that the relation to liberties would be that the liberties justify, or the infringements of liberties justify how we change our valuation of the time costs.
I think that's right. I think I would agree with that. So if we're trying to understand why we would have a discontinuity rather than a continuous function, so the idea is the claim to time is rooted in people's claim to the means to exercise their liberties. So that's going to give you some account of some kind of threshold that people require in order to exercise them. I want to be somewhat careful about that, because it will depend on your full theory of justice whether or not you necessarily interpret that in a very straightforwardly sufficientarian way, in the way that we've been talking just now, or whether or not you think about that in a broader way, so that people are entitled to a bundle of resources that are broadly used to pursue all of their liberties, and so then there are less clear thresholds. But if you take the kind of simple case, that will mean that there are. So to take the example of voting, so you have to have enough time to go vote. But then if you have, some excess of time above that, it's going to have a different value than the time that is actually required to go vote. So that kind of point can generalize beyond that specific liberty, so that there is this discontinuity, so that when you have a deficiency of free time, it's particularly problematic, and above the threshold, a loss of free time is still a loss of something of value, but it's not problematic in the same way as when you're already below the threshold or pushing below the threshold.
So that does raise the question for me. If we're thinking of free time as the number of hours a person has left over per week or per month or per unit of time that they don't have to spend satisfying their basic needs or doing other things to take care of their necessities. It does raise the question to me whether this free time consideration, whatever its relative weight and significance, cuts against or in favor of ordeals in time. Since if the alternative, the most common alternative is to impose a cost form of rationing, but when we impose a cost form of rationing, we take away from a person's savings and therefore increase the amount of time they'll have to work to meet their basic needs. So it could be actually in this. I know, Julie, you said, it's not income and free time are not always perfectly substitutable, but in a lot of cases that we might worry about in the imposition of ordeals, it looks like to me they might end up being imposing similar kinds of burdens, just at different moments in free time. Is that right?
If you want to jump in.
So this is why I think it's actually very important to get away from the language of burdens and costs and think about what it is that people are actually doing in the context of trying to gain access to these products and services. And there I think there's a big difference between sort of thinking in pecuniary terms, right, versus action that one has to undertake in the context of free time. So I don't know if that's helpful to you, Julie, but I do think there is something about the importance of it's freedom, free time, right? This isn't just another fungible resource. There is something about that. I think and from that perspective, I think that we think about, at least for me, I would think about that from the perspective of autonomy. Concern reasons would come in as to why we might think about that differently as opposed to the cost side of things.
Yeah. So that sounds right to me. The observation, I guess, just is if the alternative is to impose a cost that will deplete a person's savings and thereby lead to a longer amount of time that they'll have to work to build it back up to pay the rent the next month, then the intervention may end up being as much a cost to their free time, just not at the point of delivery. If you take a wider, yeah, that's a thought.
So two things. So one is, the first point is, to the extent that I was endorsing monetary costs, I think it's important to think about them as being highly progressive. So if we're talking about people who have little money and little free time, I think it's important that the cost is highly progressive, such that the poor are paying very little, if anything. And so then if we're talking about people who have to spend some of their savings, and then that increases the amount of time that they have to work, and that decreases their free time. But if we're talking about this monetary cost applying to the people who are well above the thresholds on each dimension, then I think that that trade-off between the two, or the way in which the two can be converted, is less problematic, because we're well above the threshold there. The other thing, I think that the things that we're both saying are very much complementary. And there's also a way in which the dignity and status harms also might have the same kind of discontinuity function that Anders was talking about. So, lots of little hurts could be small indignities, but the status is undermined below a threshold. So I think that the same kind of structure might apply. I think dignity, of course, has the supervening structure in some cases, but it might also have the discontinuity structure above the threshold. I'm not sure what you...
I'll have to think about, I guess... Yeah, I guess I think of these terms more in terms of, I guess, a violation of status. It's sort of it's not exactly I don't know if it's a discontinuity, if that makes sense. Yeah, right. So I think that's the way I would think about at least the idea of dignity and status. So
we've got hands going up, so I saw Lisa up here.
I'm not sure if I answered the question.
So one of the things that I love about the conferences that NIR does is that you always bring together all these people from different disciplines, and we learn about all the things that other people are doing that we wish we had known about. So I spend most of my time doing benefit cost analysis, a lot of it working on improving methods, and particularly for non-market valuation. We're probably going to get into this a little bit in the next panel, but there is a very large literature in economics on how people value time, both the conceptual work that goes back to, I think, the 70s that looks at a lot of the issues you guys have been looking at, and empirical work that looks at how people value time that has different characteristics, whether it's uncertain, whether it's unpleasant. So there's, I think, a huge resource here for you guys to be thinking about how people really value changes in their own time, given all the different attributes that you're all raising. I also wanted to make, this is a little maybe unfair, but make a little bit of a sales pitch. We are working on some guidelines on doing benefit cost analysis for the Gates Foundation, and are looking for people to do case studies that apply some methods papers that we've all written and that are now online that have to do with things like valuing morbidity risk, valuing mortality risk, and valuing time. So to the extent that you all or people here have been doing work in this area and are interested in looking at what you might learn from doing benefit cost analysis, that would be great. To contribute to that project, I'd also be happy to talk to you about the other work we've been doing on valuing time. We have some reviews that talk about the different issues you're raising.
Great. Nien?
That'd be fantastic, Lisa. So, thank you for the offer. It's, a friendly reconstruction of maybe a point that Nien-hê makes. If it's not exactly a reconstruction of your view, maybe set that aside. The point is whether this is of potential help for all of us. Maybe the doctrine of double effect is central here. Here's the thinking. There is always the alternative of not rationing, letting people grab the expensive drugs even if they don't really need them so much at the expense of others. That's problematic because others may be needy and others won't have, would incur maybe greater disutilities than they would by refraining from grabbing. But from the point of view of the doctrine of double effect, that's a side effect of what they will do. So in that respect, it's less severe than going for the ordeal of intentionally imposing harm, impinging on your time, making you hear loud, unpleasant music on the phone when you're calling the insurer. In one respect, it's better. There is a third alternative, using money to disincentivize overconsumption. But money is, as I think you were kind of hinting in some deontological thinkers' views, a social resource, not a personal resource. It's something that we are allowed usually to redistribute much more readily than the person's own, certainly body parts, and maybe things intimately linked with it, such as their kind of how they move their body and things like how much noise they have in their ear. So while the effect of taking away your money, as Lucas just pointed out, is also down the road that somebody will lose some of the basic freedoms that you were talking about, it's merely a side effect. Again, it's not what you directly intended to bring about. So again, some version of the doctrine of double effect might see that as less worrying than ordeals. And maybe, taking it all together, the doctrine of double effect is hostile to the use of ordeals.
I am so glad you mentioned that. I actually was going to use exactly to talk about that, use doctrine of double effect together, because the point is that the activities that the person has to engage in are precisely part of the plan, right, to achieve the desired end. And so you're right, that in that sense it is, I think, why the doctrine of double effect would, I think, be more hostile to thinking about ordeals than other ones. So that's very helpful. No, it's exactly right. Thanks.
So we haven't said anything about dignity and autonomy yet. So one thought.
I thought I did.
Yeah, no, you did, of course, but in our further follow-up discussion, we haven't spoken more about it. So
my life is an ordeal,
here's a prima facie worry about the tension between two different ways of understanding this value. So if dignity is secured by the avoidance of social stigma and being singled out for various kinds of treatment, and so having everyone, rich and poor alike, queue and undergo this similar, as Dan said, face similar kinds of obstacles for health interventions that will have similar prospects of health improvement. But on the other hand, might reasonable constructions of the value of autonomy not ask us to offer people the option of, on the one hand, undergoing an ordeal in time, or on the other hand, paying a progressive monetary cost? So first question, do you think there's something to be said for the idea that autonomy recommends offering people the option of undergoing an ordeal in time or paying a higher cost? And if you think the answer to that question is plausibly yes, does that come in some tension to values of solidarity or dignity that we might want to promote through the construction of these rationing mechanisms?
Yes and yes. No, I mean, sorry. Look, I mean, yes. Look, autonomy always raises these interesting challenges, right? Tensions between some important consideration, value, set of principles we have, and respect for autonomy. I think there's always this. So I guess the question is there something distinctive about the challenge here with regard to the potential for the tension between privileging autonomy and then sort of undermining certain other values we think are important, or maybe there is something that's distinctive here. I think maybe that's what you're getting at. Is that the idea?
No, I mean, to me it looks like a general problem, and
I actually, now that you put it this way, I'm thinking that maybe there is something challenging here. Say, for example, it might be different from questions of paternalism. Right, that'd be another common way in which you think about, okay, well-being, interests versus autonomy and being in tension. And I'm going to think about this, but I think you're right. There may be something about I'd have to be much more precise in how I'm going to define autonomy and what it means to violate dignity to get it. But I think you're onto something that could be a very deeper tension here. So thank you.
Can I invite questions from the audience, please? Katie, could you come up and speak into the microphone?
That's good. That's very good.
Just one question. So, Catherine Young from Boston College, about the assumption that the cost of the ordeal is a non-monetary one. The market will always have this tendency to break out, as many economists recognize. So we're living in an age where technology allows people to pay for all sorts of things. You know, TaskRabbit is an app where people get people to stand in line for them or do any number of ordeals that they face, wait on the phone for them. It's very easy to outsource ordeals. So I just wonder about this is how easy it is to make that assumption that the ordeal is a non-monetary one.
So I think, so the reason I said this, I mean, I think this is one of the issues that sort of lies in the background as some kind of confusion for a lot of people, whether or not we should include costs that might be monetary in our conception of ordeals or not. The reason I said this in my presentation is that Richard Seckhauser, as he introduced the concept, made it very, very clear that that was what he had in mind. But I do think that, you know, a lot of the very, very similar problems arise also when we start talking about monetary costs. But I think that another issue that you're touching on, which we haven't spoken that much about, is whether or not there are ways to use money to bypass ordeals that were not intended to be monetary costs. So, for example, if we introduce some inconvenience, filling out a form, and a billionaire pays some programmer to develop a computer program to do that work for him, then he managed to somehow pay the price in terms of money instead of the intended inconvenience or whatever it might be. So, and to what extent that's going to be problematic is, I think that's going to be context dependent. But, yeah.
Christopher.
I just thought I'd comment on that, and then leads to a second point that in my work, I try really hard to delegate a lot of the ordeals that come up in academic life. And I find it's actually really hard to do that. I mean, there's only so much a research assistant can do. And I think physicians likewise, thinking about when physicians face the ordeal, yeah, they can hire another office manager. But at some point, the insurance company, it requires the physician to be on the phone to do that prior authorization conversation with the doctor at the insurance company. And so there's sort of both purposefully, but also functionally, there are limits to the fungibility of time with money. And so that's going to be true for healthcare often. You can't really pay someone else to wait in the doctor's office for you, because, of course, your body needs to be there at the moment that the doctor's willing to see you, which is somewhat unpredictable. So I think the fungibility is, in practice, perhaps quite limited, notwithstanding the principal point. The other thought that occurred to me to comment is how often ordeals are actually going to be a redistribution from whoever holds the resource. By imposing the time cost on the individual, which I think this panel has really made nicely explicit, they're really shifting, saying we're going to withhold this resource of consuming the chlorine tablet, for example. We're going to save 60 out of 100 chlorine tablets back, but we're going to impose miles of walking on this population. And so it's an interesting trade-off whether the net number of miles walked is actually less valuable than those 60 unconsumed chlorine tablets, and what's the alternative utility for them.
Just about the possibility of TaskRabbit. So I take the point that, of course, there are some things that you can't outsource and that you actually do have to be physically present for, or that by design, you have to be on the phone or signing the paperwork. But to the extent that the ordeal can be outsourced and you can hire someone to do it, it seems like that just gives us an additional reason to use progressive monetary costs rather than ordeals, because the ordeal was ostensibly a flat cost that everyone was paying, but now the rich are able to buy their way out. Instead of letting that happen unintentionally, contrary to our design, instead we should just take that into account when designing the cost and make the cost explicitly progressive.
One question. I think also we should be clear on the idea of markets and then sort of markets in practice. Okay. And so if you think about markets I actually take your point. I actually think this distinction between pecuniary and non-pecuniary as a way to distinguish ordeals from markets, based upon what I said, I think I'm actually sympathetic to your point that maybe that's not the way to make the cut in some sense between, but certainly from a definition one could, right? And that's, I think, where it's important to think about the idea of markets rather than markets in practice. And so maybe what's going on here is if we think of the market in its very pure form, one way to understand it is that basically it's the price mechanism that's serving the role of allocation, right? It's just a price mechanism. And if that's how we understand the market, then yes, that does seem different from how we think about ordeals in terms of allocating access to services and products. So if we take that very pure idea of a market, then I could see why that might be different. But once we move into thinking about markets in practice, it seems to me that many of the reasons we had to be concerned about ordeals, right, give us also reason to be concerned about what goes on in the market as well.
Great. Well, in the interest of not imposing ordeals on the audience, we have run past, so please welcome, join me in thanking the panel.